Oh, yeah. They definitely freaked me out. Extreme hospital chaos. I'm not sure that's survivable, and whatever nightmare fuel is happening here. Today, we're back in the upside down, breaking down, and reacting to the most disturbing medical scenes and electrifying injuries from Stranger Things. Let's dive right in.
Can you lift it? Can you show us?
Oh, that's a big laceration across the chest wall. What we would normally do in this scenario. The bleeding isn't too bad. There is some blood pooling. Normal. What we want to do is anesthetize the area and clean the wound. It'll actually help vasoconstrict the small blood vessels, so the bleeding will significantly slow down. I mean, that response is kind of everybody's response, even people in healthcare.
Yeah, it looks like just the right amount for a couple of bad scars.
Yeah, you're gonna definitely have a scar there. If there is an injury deeper, you need to do subcutaneous sutures, and that's when we typically will use absorbable sutures. Sometimes in the emergency department, if you're pressed for time, you can just staple this shut. Whoa. How quickly and easy. Putting some butterflies in. The only time we use butterflies like that in the emergency department are for blood draws, but they're making it look like these are IVs, which is not normal.
She needed my blood. She just kept taking.
Interestingly enough, they did take the blood with those butterfly needles versus injecting fluid in.
I can't think of her as a kind of vampire.
When we have to draw blood, patients are like, oh my gosh, that's so many vials. That is so much blood that you're taking out of my body. It's not that much. Typically, we have 10 to 12 pints of blood in our body-ish. When you lose a lot of blood, you become pale. You can have these dark circles. The color of your lips will go. The mucous membranes will change color. The best place for me to look is the conjunctiva, the red area underneath here. If you are anemic, it's going to be very pale. Whoa, woken up, didn't want to be bled anymore. Scalpel laceration to the neck. If the scalpel is able to hit the carotid artery or the jugular vein, you're gonna have significant amount of bleeding. If it doesn't go that deep, because there are protective areas of the neck where it's overlined by muscle, then it's just gonna cause superficial bleeding. Plus or minus, did it get into the airway? It potentially could cut in and cause difficulty breathing. Scalpel, you can see how long that is. That is a 15 or a 10 blade. You're doing superficial stab puncture wounds to that area. It might be going in like a centimeter or two, depending on the area of the chest that's actually being hit. Oh, yeah. They definitely freaked me out. This flower looking thing with all the teeth in the world. That is a lot of canines. Canines are sharp teeth versus the incisors, which are in the middle, and then the premolars and the molars, which are in further back, which help with grinding and mashing versus cutting and ripping. Electrical? Yeah, wow. Oh, interesting. So it looks like we have an open fracture. So you're actually seeing maybe some bones sticking out. In the emergency department, we would try to put that back in, even though it's still dirty. Then splint it, stabilize it. You're going to cover it with some antibiotics and get orthopedics involved because they need to take this individual to the operating room to wash out that area. Just like we use energy to restart somebody, kind of the same idea. You're restarting some of the body's action potentials and nerves to get things firing, but it doesn't work quite the same on, say, like a human, or if a human is passed, trying to give them more energy, it doesn't matter. What is happening?
What is happening?
Enough energy, it's almost like the electric chair. You're gonna cause frying of the nerves, seizure activity, potentially kill the heart. The muscles are being burned, which increase the risk of breakdown of cells, which will release a lot of potassium, will then cause electrical abnormalities, cardiac arrhythmias, can lead to renal failure. Whoa! So cool. That is amazing. This anatomy is totally not normal. Strands that could be like small strands of muscle, but they extend and contract almost like your intestines. We can't do that. Oh, we're on a cardiac monitor. There's a pretty high heart rate without the numbers that I can see, and quite irregular. slowing down because she's becoming hypoxic. And this is actually quite common. When you're losing oxygen and you're about to pass out, you're going to have a slower heart rate. And then if you don't get oxygen soon enough, you're going to go into cardiac arrest.
Cardiac arrest.
Oh, very cool. Oh, ow. Snapping it. Looks like it's just below the knee. Proximal tib-fib fracture. Painful as hell. There's no skin to pop through, so we'll just call this an open displaced fracture. That needs to be hardwired back into place, likely with antibiotics and washed out. What the heck is this? What is this like big structure that I'm looking at? Almost beating like a heart? What is that? Let me know in the comments.
Time for my vessels to lead us to a new world.
Oi. All of them have like this connection with something into their mouth. No idea. Like this is not normal, right? But we do. Same thing when somebody is sedated and we need to breathe for them. We put the breathing tube in their mouth. Oh, bleeding out of the eyes. Bleeding out of the eyes looks so scary. It typically is not anything really dangerous unless the blood is coming due to the trauma of the eye. A lot of times we'll see tears that are bloody coming out of somebody's eye because they've had like some sort of nasal trauma or something related to a sinus.
I won't hurt you. Please, mister. Don't shoot.
Who are you?
This gentleman has a head injury on the ground, bleeding from the right side, traumatic brain injury, could be bleeding inside, could have a skull fracture. Need to wash that off and see what the wound looks like. Typically, if somebody's confused after a head injury in the emergency department, we're going to get a CT scan of the head.
They sent you.
You're just confused. You need a doctor.
Oh. Took a gunshot wound to the hand. A lot of bones in your hands, right? Those are your metacarpals. Fracture right through there. Could go soft tissue and might miss and go straight through the hand. Would also cause injuries to the nerves themselves. That escalated quickly. Repeated damage to the head. He's getting blood splattered on his own face, which if there's any bloodborne pathogens, you increase the risk of getting that into your own tissue because your eyes, your mouth, mucous membranes, you can absorb the blood in if it's a decent viral load. This person's outfit is like red stripes, and so that was a thing back in hospitals in the past. The candy striper, they were basically like help in the hospital, non like medical care activities, running errands, getting food. Holy cow. We don't see this very often. Sometimes in really horrific accidents, we'll see this. Gunshot wounds, bad car accidents. It's bleeding control if the patient's still alive. Significant amount of plastic surgeries in the future. Oh. Besides the glass causing lacerations, puncture wounds, you could have compressive forces of the explosion that can pop your eardrums, could cause your lungs to collapse. You can have something called tinnitus. You may not be able to hear well. Whoa. Awful. Look at his face. Significant scarring, maybe some burns to the area as well. Burns themselves take a very long time to heal. And then you have extra scarring going on that area, which then causes the tissue to be extremely tight. Oh, gunshot wound to the face and the head, going straight through the brain. Depending on where it hits in the brain and in the face, does it actually kill you? If you miss, you go sideways, which can happen. You're left with disaster, but still alive.
No! No, Golly! Golly!
Oh.
Bandages, please!
Keep pressure on the wound.
Good. Keep pressure on the wound, like a lot of pressure. People are like, oh, let me just put a little bit of pressure. No, you need to be a lot of pressure to get that to stop. But that looks to be like an abdominal wound. Shove shirts, gauze, whatever you can into the wound to try to protect it from pulling out.
Look at me, hang in there, okay? I'm here. It's gonna be okay.
If watching all of these intense run-ins has your stress levels climbing, you might need a little occasional stress support. That's where Chillax from my company, Life Happens, could come into play to help you stay calm when life goes sideways or upside down.
Upside down.
Find it at lifehappens.com or on Amazon. Oh, cool. Oh, snap. Literally.
Literally?
Snapped off that right arm. We got dark blood. Our blood's not that dark. What would you do if somebody has an amputation? Tourniquet it. Remember, bring the limb with you just in case there's an amazing surgeon that can do a replantation surgery. Oh, not compatible with life with that big of a puncture wound impaled into the back, going through where your heart would be, your lungs would be, and all the major blood vessels. That is huge. Massive amounts of flames. So if this flames were like in a human, you always worry about melting of the airway, suffocation, because it's taking all the air from around you. We get concerned that, oh, it might have went into the airway, so we probably need to intubate sooner than later. Still alive. If you take this creature off of this spike, it will bleed out immediately. Remember, I always say, don't pull it out. It's because of this, because it's still tamponading the area and not allowing it to bleed out immediately. So it's slow bleed. Stranger Things, very entertaining. I know there's a lot of fans out there that love the series. Let me know how much you like it. What are your favorite scenes? Who your favorite characters are? I would love to know that. Did you watch the finale? What are your thoughts on the last season? As always, make sure you definitely binge watch this playlist right here, and please make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.